Hi. Testosterone is a very important hormone. If I said to you, what is testosterone? You'd say, oh, well, that's a sex hormone, like estrogen. And you'd probably say testosterone for men and estrogen for women. Now, that's actually not at all true, because both hormones are important in both sexes, and testosterone converts to estrogen in certain tissues. But that's by the by. What I want you to think about is testosterone not as a sex hormone, but as an anti-aging hormone. And testosterone is very, very important in terms of the disadvantageous changes that occur with old age in some people. The problems like frailty, loss of muscle, loss of power, dementia, and loss of essential faculties like sight. So, testosterone is an anti-aging hormone. Now, the evidence for that is fairly widespread and fairly well understood, but poorly by scientists, but poorly understood by doctors. And so you won't come across this concept widely discussed. But it's very critical if you want to maintain your function as you get older. Now, not every man loses testosterone significantly. So if we take anybody at the age of 60, then about 20 or 30% of those individuals, those men, will have a lowish testosterone. And by the time we get to 70, we certainly will have 3 or 4 men out of every 10 with a low testosterone level, a testosterone level that's low enough to cause a variety of adverse consequences. So we know that there are some men who can father children, be sexually active, and still seem to be unchanged in their later years. But you also see around you men with a rather baby face, a loss of assertiveness, a mildness that they didn't have before, and a lack of decision, which are all hallmarks of low testosterone. And these men will have low sex drive and will almost certainly have ceased to have the major landmark of adequate testosterone production, which is the presence of an early morning erection. So testosterone is low in some but not in others. And I feel very strongly that any man 60 plus needs to know what his testosterone level is. And that means having a blood test done in the morning. Doesn't have to be fasting, but done in the morning, because blood levels change throughout the day. And so the standard approach is to test in the morning. So what are the problems with having a low testosterone? Well, the 30 or 40% of men who have a low testosterone, and sometimes that low testosterone is a lowness of available testosterone because somebody's overweight. So even if you've got a good output of testosterone from your testicles, if you're fat, then you produce a hormone called sex hormone binding globulin, which mops up a lot of the available testosterone. So you don't have the same beneficial testosterone effect. But anyway, so the consequences of low testosterone are an increased risk of dementia, loss of muscle mass, loss of sexual function, which you may or may not feel to be important, and depressed mood, which can certainly be a major issue. Problems with joints, an increased risk of heart attack and stroke, and an increased risk of diabetes. Testosterone also has a variety of other effects. It's involved in the strength of collagen and skin, all very important structural features. And testosterone has important effects, for example, in the eyes. Testosterone deficiency leads to dry eye syndrome and an increased risk of macular degeneration and other retinal problems. So having a low testosterone is bad for you, but it isn't a problem that affects everybody. The article that goes with this covers this information and some of the evidence for the things that I've stated here. And the second part of the article goes on to the issue of how to take testosterone replacement and the value of doing so, and the fact that there are little or no adverse consequences. So if you need a bit more testosterone, it's very safe to get some.